Hi, my name is Dr. Jack Arnold. I'm a wound care doctor here at Clark Regional Medical Center. Also have a family medicine clinic upstairs. Well, I always wanted to be a family medicine doctor and a doctor in general, and wound care has come along with being a thorough family medicine doctor. Got an interest in wound care when I was a resident, shadowing different wound care physicians. An opportunity arose here at Clark Regional for me to further my wound care intervention, so to speak. I really enjoyed that and really enjoyed the wound care aspect of my practice. I've been wanting to be a physician since I was a little kid. My grandfather was a family physician in Mount Sterling, and more of a jack of all trades than just a family physician. He was the OB-GYN there and everything else. I sort of modeled myself after him, and that's the reason I feel like I was eager to jump into sort of a subspecialty of family medicine, and doing things that regular family medicine doctors wouldn't do. I went to the University of Kentucky for undergraduate, and then I went to the in-state rival, University of Louisville, for medical school. I am a UK fan, so if you're a UK fan, don't worry, I'm not going to, press my City Cardinal fan love on you. Did my residency down in Florida. Also did a little bit of training up in Ohio, and did some hyperbaric medicine training in Texas, and some further wound care training out in California. So that's my background. It's quite a lot of study and quite a lot of tests. I'm technically a family medicine board certified physician, but I do wound care, as I mentioned earlier, and hyperbaric oxygen therapy. I'm from Central Kentucky originally, and I have a lot of family ties to this area, a lot of friends and everything, and I gave up sunny Florida to come back here to be home with my parents and my wife's parents, and to raise a family and to be around friends and family. And so Clark Regional seemed like a great fit. It's the rural setting that I desired. I didn't want to really work in a major hospital inside of a city. I really enjoyed here. I'm also an avid fantasy footballer, so if you ever want to talk some fantasy football while I'm working on your wounds, that's always welcome. Big college basketball fan, being from Central Kentucky, yeah, I have a daughter and a wife and a very busy medical practice here at Clark Regional, and that pretty much sucks up all my time, but I do try to keep my medical knowledge up and my continuing education, and that's probably actually sums up my hobbies. What sets Clark Regional Wound Care Center apart from other facilities that heal wounds is, first of all, our numbers are fantastic. We do a great job of healing wounds here when you compare us nationally to other wound care centers. Secondly, we have hyperbaric oxygen. When you hyperperfuse a wound with oxygen, it tends to heal faster. It allows skin to grow better. Wounds that have been stagnant for years, hyperbaric oxygen tends to really make a big difference. Also, folks who've had radiation damage, they have had years of chronic pain from radiation damage to internal organs. We're able to fix that a lot of times and relieve those issues. We get a lot of referrals from specialists from around the area who've been sending us patients who've had radiation damage, and it's been nothing short of a miracle for them a lot of times. I love what I do because I get to see the physical manifestation of watching a wound heal and seeing the joy on a patient's face when the wound does heal. Because I have people who come to this wound care center who've been dealing with wounds for years and sometimes even decades. And we're able to heal those here using multiple techniques. We got hyperbaric oxygen. We have, here in Little Winchester, Kentucky, we have the top-notch wound care facility here. And we've been able to heal some very difficult wounds that other wound care centers and other providers haven't been able to heal. And when I see that joy on patient's face, it really makes what I do so worth it here at Clark.